Good afternoon, everybody. Thank you so much for joining us for our webinar today, where we're highlighting collaboration to support youth employment outcomes. I am Kim Osmani. I'm a Senior Extension Associate with the Yang Tan Institute on Employment and Disability at Cornell University, which is one of the partners on CAPE Youth. I am a middle-aged white woman with dirty blonde hair wearing glasses, and I am really excited to welcome you all here today. Today's webinar is going to highlight ways that states can improve collaborative efforts that support the transition of youth and young adults with disabilities to adulthood. We are going to hear from speakers from the U.S. Department of Labor, the Utah State Board of Education, and CAPE Youth. We appreciate all of today's presenters and all of you for joining us today. So before we get started, I would like to draw your attention to a few housekeeping items. To reduce noise during the conversation, all participants will be muted during the entire webinar. Closed captioning is available through Zoom. Access can be found under the Settings tab on your Zoom toolbar. You can also use the Q&A feature that we have enabled in Zoom for submitting general comments, any technical needs that you may have throughout the webinar, or questions for our panelists. At the very end of the webinar, we're going to facilitate a Q&A session. So you can either go ahead and put your questions into the Q&A, and one of our team members will keep track of those questions and pull them up at the end, or you can hold your questions for the end and put them in the Q&A at that time. Lastly, today's slide deck and the recording of today's webinar will be made available within a few weeks on our website, and we will share the slides in a follow-up email with all of you as well. So let's get started. Today's presentation is actually part of our CAPE Youth project. CAPE Youth stands for the Center for Advancing Policy on Employment for Youth. And our mission is to really help build the capacity of policymakers across the nation to support youth and young adults with disabilities in their transition to adulthood and employment by helping states build that capacity in their youth service delivery and workforce systems. That's a lot to say, but we're really excited about the work that we do and the work that all of you do to help support youth and young adults with disabilities in employment. CAPE Youth is funded by the U.S. Department of Labor's Office of Disability Employment Policy, otherwise known as ODEP. CAPE Youth is a collaboration among the Council of State Governments, or CSG, the Yang Tan Institute on Employment and Disability at Cornell University, the Interwork Institute at San Diego State University, and the National Association of Workforce Development Professionals, or NAWDP. This is a 5-year grant, and we actually just began year 2. This is our second cycle of having this grant, and we're really excited to continue the amazing work that we've all been able to do. So now I would actually like to introduce our first speaker for today. Jennifer Kemp directs the Division of Youth Services at the U.S. Department of Labor's Employment and Training Administration. Her team is responsible for the day-to-day operations, technical assistance, performance, and policies of several youth development and employment programs. She also leads the agency's justice reentry programs for youth and adults. The largest of her portfolio programs include the Workforce Innovation and Opportunity Act, or WIOA. I'm sure many, if not most of you, are very familiar with that here today. Specifically, their youth formula program, Youth Build program, and the Reentry Employment Opportunity program. Jennifer has also led the youth policy team for the U.S. Department of Labor's Office of Disability Employment Policy. Past work experience includes leading national, state, and local grant programs. She was staff on the U.S. House Appropriations Committee and special assistant to the chairman of the President's Committee on Employment of People with Disabilities. Jennifer began her federal career through Workforce Recruitment Program internship at the U.S. Department of Defense. In addition, she has worked in nonprofit, university, and corporate worlds. She holds an undergraduate degree from the University of Michigan and a graduate degree from Vanderbilt University, and lives in Washington, D.C. with her husband, children, and family dog. Jennifer, we are so pleased to have you join us today and kick things off.
Thank you, Kim, and I'm really excited to be with you all. And as we were talking beforehand about how you would describe yourself, my bio says that I'm not a youth anymore. I am similarly a middle-aged woman wearing glasses. I have a very apparent disability. I never hold still. I have cerebral palsy. And so it's really exciting for me to once in a while come back and talk to the community where I started, the disability community. I don't think I need to say that much about what I do because Kim kind of covered the highlights of what I do in the Employment and Training Administration. I am the portfolio that my division oversees is a large portfolio. We award around $1.4 billion a year with a B. So it is quite a large portfolio. And what I really want to stress is when you think about those funds, you have to think about the people that you're serving. Because it's really the money is a small part of it. At the end of the day, if we don't do a better job serving the youth in this country, who we would label as opportunity youth who have a barrier to employment or education, then I'm not doing my job. And I take my job seriously. So when I think about what we do, I think that collaboration is the key to what we do. Um, and one thing that's really shined a spotlight on what we do in the Employment and Training Administration and across the Department of Labor the last couple of years is we adopted a youth focused vision. We may not call it a youth focused vision, it's sort of more of a strategy. But this has really been a very galvanizing thing for us here at the department. So, key tenets of that work is this concept of a no wrong door. When I am a person and I go to ask for help and I go to the wrong place and someone says, I can't help you, it's very disheartening. Um, and we don't need to do that. When we're working with youth, particularly youth with disabilities or other barriers, they get a lot of no, move away. And what we want to do is say, oh, come on in, sit down, let me see how we can get there. So we're really focused on this no wrong door approach and working very collaboratively across with our federal partners, our partners in the building, if you will, which is part of the reason why I'm here helping ODEP with these remarks today. Another key focus of our work is paid work experience. Youth, but particularly youth with disabilities, need to know that their work is valued, that what they do is rewarding, and not just personally rewarding, but rewarding to their wallet. Their wallets may be virtual now, but they still need the funds in their wallet to participate in life, really. So we're really focused on providing on our youth with paid work experience. And then the third tenet of this approach that we're working on is this collaboration and developing partnerships, which goes hand in hand with the no wrong door approach. Um, and so when I was thinking about today's presentation and everything that you all are trying to accomplish, one thing that I have found very helpful in my work in the federal government is to really have a vision, to have those things in mind that I want to change. And I guess I'm going to pause here for a second and ask you all just to think, maybe write down on a piece of paper in the spirit of like what you're grateful for or in the spirit of New Year's resolutions. Like, think for a moment about the thing that you really want to change in your environment, your work environment, to benefit the people you're working with. Because having your vision on one set thing really helps build the collaborations and the partnerships. It makes you realize like what you are focused on, what's negotiable for you, and where you're trying to go. Because if you don't really have a clear vision of where you're trying to go, it's hard to know if you got there. And so for us, really having a focus on paid work experience is very beneficial to the work we're doing because it helps us understand like we have been successful because more youth are being paid for their experiences, for example. Um, Now, as you might, if you're like I am, you love taking on lots of exciting opportunities and ideas. It also helps you sort of narrow your vision, right? Keep focused. So just something to consider as you're listening to the other presenters today is really what do you personally want to focus your work on or your mission or your vision for your agency or wherever you fit into the organizations. One other thing that comes along with like focusing your vision and focusing your mission is knowing the laws and parameters in which you work. I have not worked at the state level, but I can imagine that's a lot like working at the city level or the federal level. You need to know who your partners are. You need to know who you can call to get good answers. You also need to know the legislation that you're working with. And sometimes you have to ask, why is that? So for us with WIOA, one big why is that is a lot of times we heard, particularly before COVID, that our funds couldn't be used for devices like iPads, things that were like, why is that? Because a lot of times people have this thought when they're reading things that, oh, well, we couldn't do that. And sometimes the federal level will say, sure, you can do that. And the state level will be like, put extra like limitations on things because sometimes they're nervous. So I think a lot of times people will limit things not because they don't think it's a good idea, but just they're nervous. So I think having the ability to step back from some doors that sometimes seem sort of closed and say, why? Why is that practice in play? With the WIOA work in the last few years, we heard a lot of people say, well, we can't like advertise our programs. Essentially, we can't tell people about them. There isn't funding to pay for that. Well, that was really useful information for us to have because we were like, oh, that's not actually totally accurate. And we really focused on a yes, we all can model, which is questioning what people are saying and thinking about how you can use WIOA in a more creative way. Because it is actually a pretty broad law that a lot of times and people just think it's limited, and that's not always the case. So I really, if you're not familiar with our Yes We All Can work, I would encourage you to Google that. You will see a lot of good opportunities for you to think differently about how you might work with some of those funds in your state or your local level. And that brings me to the final thing I really wanted to share, which is our youth systems building work. So as I mentioned, I'm at the federal level. I know right now that I'm a good target to be like, oh, you don't know, right? And I respect that perspective. And I really have enjoyed the work that we've done with states and locals because it does give me a different perspective. I will also say I'm not that working with states and locals helps us to better understand some of the issues that you all are experiencing. And one place that we really worked on this in the past year is through our Youth Systems Building Academy, where we brought 19 different communities together to look at data, outreach, partnerships, and think about how they can build a better youth system for the youth in their areas. So we will put a link to our documents there that will give you ideas of how different local areas in the state of Alaska, the one state that was involved in this project, have been looking at data, outreach, partnerships to better serve you and just reach those three broad goals, which I started with, which is the no wrong door approach, the paid work, and the focus on partnerships. And so I kind of want to close my brief remarks here by saying that not everyone has a disability that's as apparent as mine. And I recognize sort of in a way I'm fortunate to have a disability that's so visible because people take a look at me and they think, oh, here's some other resources for you, right? And I want us to think about the co-occurrence of disability. And when you're working with your projects, recognize that I would say a lot of the folks who receive services through WIA youth programs do have co-occurring disability diagnoses. They might not disclose it because if I was a young person, would I tell you I have all these barriers? No, I would pick the easiest one to get services with. But to get in that door, right? And then to build on it. So I am very excited to hear more about what we're going to hear from our other panelists. I'm happy to answer questions later. If people have questions, please put them in the Q&A portion. And I am going to turn this back to Kim. Thank you.
Jennifer, thank you so much for opening the event and for your passion about youth services. Everything you mentioned, from the No Wrong Door to the work experiences and having that vision, working with federal partners, all of those require collaboration. So you just did a great foundation setting here for us today. So we really appreciate you. We appreciate the partnership with ETA. And thank you so much for being here today. So now I would like to introduce my colleagues from Cornell University who are also part of CAPE Youth. Each of them will introduce themselves, but it's Dr. Matthew Sala and Dr. Leslie Shaw.
Okay, with that, I think I'll take the reins. So my name is Matthew Sala. I am a 39-year-old male of Middle Eastern descent. I'm wearing a green sweater. Just for background, I'm a senior research associate at Cornell University's Yang Tan Institute on Employment and Disability. And I'm also co-director of an institute called the Criminal Justice and Employment Initiative at Cornell. So that kind of cross-systems focus is a big part of my own work. I'll let Leslie introduce herself when she starts her slides. But before getting into that, I wanted to give you a little bit of an idea of what we're covering today in terms of subject matter. So first of all, our goal is for participants to learn how what we call instrumental practices of collaboration can lead to improved employment outcomes for youth who are youth with disabilities and other barriers to employment. So what we mean by instrumental practices of collaboration are things like frequency of communication, knowledge sharing, types of collaborative practices that are kind of demonstrated in the literature to increase those outcomes. We're also going to talk about, because we did this study during the COVID-19 pandemic, there were some unique learnings that came from doing the research project that we're going to describe in terms of things that people were doing differently at the state level, at local levels, that maybe actually, even though that was a unique time, that could carry over into practice post-COVID. And then we're also, one of the goals of today in describing what we describe is also, as you see the examples that we provide, the research that we describe, we also want you to think a little bit about how this can help you envision what your own network might look like, and what kind of how some of the collaborative practices we describe can be applied to your own work. To that end, we're going to be discussing both a mixed methods research project that we conducted at CAPE Youth. And we also obviously have our partners from the state of Utah who are going to describe kind of some of these concepts in action on the ground. So why are we studying collaboration? What was the kind of general framework for analysis here? Obviously, the Workforce Innovation and Opportunity Act was our starting point. This law, as many of you know, renewed focus on collaboration between vocational rehabilitation, workforce development, and other agencies and partners that serve youth and young adults with disabilities. The specifically stated by the U.S. Department of Education is that the goal of this renewed focus was to ensure that the full range of services are available regardless of disability or cultural background. But again, as many of you know, there are still challenges that remain for effective collaboration at state and local levels. And of course, the pandemic kind of, in some ways, really drew out some of those challenges, right? They exacerbated them in some ways, and on the other end of that, on the flip side of that coin, also caused agency partners to think a little bit differently about their collaborations. So again, I think it bears mentioning, like, what are the kind of like what's the practical utility of improving your collaboration and coordination between agencies that serve youth with disabilities and young adults with disabilities? The first is that I think many of you have heard it kind of recommended as a best practice. Collaboration is kind of something that's commonly recommended to state level agencies, to local partners, with the objective of increasing service coordination and the coordination of services and supports between agencies. Things like information sharing, cross-agency referrals, reducing service gaps, decreasing the length of time between services, assisting with the transition to adulthood. These are all objectives, and also acknowledging the fact that many youth that are in the populations we're talking about are or will be multiple systems involved. What we mean by that is For instance, vocational rehabilitation or education might not be the only system they are interacting with. You can also include agencies like Social Security, juvenile justice, foster care, developmental disabilities agencies, mental health. So when we talk about collaboration, and you're going to see this in the study we did, we are thinking of it as a broader network, not just the WIOA required partners, but also other agencies that are youth that are likely to be touch points for some of the youth that we're trying to serve. So one of the challenges here, and this is one thing we tried to address both in our literature review for this project, but also in the research itself, is that collaboration can mean a lot of different things. This is a word cloud that shows all the different words that might be associated with collaboration. And one thing we found in the literature, right, is that there are really two different ways to think about collaboration when you're talking about working together to improve service delivery outcomes. One of them is called synergistic collaboration. The other is called instrumental or task-oriented collaboration. What the research literature has shown is that the synergistic type of collaboration, which is more like how do you get along, do you trust one another, so kind of more abstract concepts, it's not that that stuff isn't important, but it's not as strongly correlated with youth outcomes as the more task-oriented instrumental measures, like how often you communicate. Do you have formal interagency agreements like MOUs, MOAs, what it might be? Do you share resources? Do you have clearly defined roles? So you're going to see that as we try to define definition, collaboration, and as we kind of empirically explored what collaboration looks like at the state level across the United States, we were kind of steering towards like things that are measurably instrumental and kind of can be shown, things that you can kind of keep track of that you are improving, right? A simple example of that is, you have meetings more frequently than you used to, right? That's something that's actually tangibly measurable. So when we define collaboration in this webinar, what we're talking about is the action of working with someone to produce or create something, right? Here, the outcome being improved employment services, improved transition services, improved continuity and coordination of care across service systems, but also with specific behaviors in mind, like sharing partner knowledge, increasing the type and frequency of communication, formalizing your partnerships wherever possible. And that can be at the state level, that can be at local levels, county, whatever. Data sharing efforts, right, which that's a huge challenge and barrier to service coordination in pretty much everywhere you look, and shared decision-making and role clarity, right? So those are things that might be in an MOU or an MOA, right? This idea that we know exactly who's doing what or who to go to as a point of contact. We know who's making certain decisions within our partnerships. So these are some of the things that kind of rise to the surface in the existing literature on collaboration. And they were also things that really did come out in our mixed methods research study. So with that, I'm going to hand over to my research partner in this, Leslie Shaw, and she's going to explain the research project that we did and kind of the starting with the research question. So Leslie, I'll hand it over to you.
Okay, thank you so much, Matt, for getting us started on this, talking about this research study. Hello, my name is Leslie Shaw. I'm also with the Yang Tan Institute on Employment and Disability. I am a middle-aged white woman with short, graying brown hair, wearing glasses and a black sweater. We had these general ideas about collaboration. We then took those general ideas, what we learned from the literature, and came down to what questions are we asking? So we wanted to know, what are the existing levels of collaboration among agencies serving transitioning youth and young adults with disabilities? That's the Y and YAD. And also, what common features are present in states showing strong collaborations? So we answered this in two phases in a mixed methods research study. Phase 1, we surveyed supervisors and frontline service providers. So those are the people working directly with youth in the field across those key agencies across all 50 states. And we also then drew in Rehabilitation Services Administration 911. So that's your case management data into the analysis. And then phase 2, we conducted some focus groups with a subset of professionals in 10 states, in which those 10 states were selected based on responses to the survey in phase 1. Next slide, please. Okay, so We reached out to all 50 states. We also reached out to the territories and received 338 responses to the survey. Our largest group of respondents were working in vocational rehabilitation agencies, all the way down to workforce Title II. So that is your adult education and literacy, and that's where we had the fewest responses. And because this is a common question we get, workforce Title I, that is your adult programs, youth programs, your local workforce development boards, and so on and so forth. Okay, next slide. And what did we ask them? So the first thing we asked them was to rate themselves, well, actually rate their level of collaboration with all of their partners from all of the other agency types. And Matt mentioned a number of those different agency types, and they were listed on the last slide as well. And that levels of collaboration ranged from 0, I know nothing about this agency at all the way up to 5, which is full collaboration. We also asked about frequency of different collaborative practices, partner knowledge, collaborative practices, data sharing, and the impact of COVID. On average, people had about 16 years worth of experience in the field of working with youth and young adults with disabilities, with 10 years at their current agency. About 40% were supervisors. That also included program directors, as well as agency directors working at the state level. 3/4 of them identified as male, 80% identified as white, and 90% of them as non-Hispanic. Also, 3/4 of them did not indicate they had a disability. Next slide. Okay, so this is one of the first findings that we wanted to share with you today. And the data that's behind this graphic is that levels of collaboration scale, in which we were asking people to rate. So say I'm in that higher education down on the lower right corner. I describe my level of collaboration with all of these other different agency types. And the closer that I am collaborating with somebody, the shorter the line is between me and that other person. And the weaker the level of collaboration is, the longer the line, the longer the space between. So in this graphic, in which you'll note there are nodes with agency types, and in the center, there is a node with vocational rehabilitation, developmental disability, and Social Security. Those are all very much at the center and close together, indicating a higher degree of collaboration among those 3 agencies. Title I workforce, that's also relatively close, along with mental health and education. Child welfare is just a little bit further out, but still not too different when it comes to the degree in which child welfare is collaborating with all of these other agency types. But what we then have separately on the other side of the screen to the right are 3 other agencies, and that's juvenile justice, Title II workforce, that adult education and literacy, and higher education. Those 3 were closer to each other and separate from everybody else in this national network map. So this is representative ratings across all 50 states from all of our survey respondents. Next slide. The next step we took was looking at the survey responses on all of those different elements, those instrumental components that Matt talked about of collaboration, the levels of collaboration scale, frequency, knowledge, quality of practices, data, and COVID. And we wanted to see how those different elements of collaboration, to see if they were related to state vocational rehabilitation employment outcomes, as well as skill gains. So skill gains is obtaining credentials or degrees is typically what we're just talking about there. What we did not find was any connection between any one of these elements of collaboration and employment or skill gain. But when we created a sum score, essentially, of our collaboration measure, it is moderately correlated with employment outcomes. Granted, these numbers were from July 1st, 2020 through June the 30th, 2021. So we were in the midst of COVID, and that may have impacted our findings. But let's move on to the next slide, Matt. Okay, the next thing we looked at was, did a person's job role have an impact on how they thought about collaboration? And the answer, short answer, was yes. And so we looked at most of our respondents, in as far as our largest group of people who responded were supervisors, and those were program directors as well, transition coordinators. And we compared their collaboration ratings to those working in frontline roles. Frontline role respondents rated themselves a little bit lower on the levels of collaboration scale. And those are those ratings where they're rating other agency types, but about a full point lower than their supervisors when it came to knowledge about their partners. And we do know, in order to really support these youth and young adults with disabilities effectively in the field, knowledge about partners is key to connecting them to the services that will benefit them and hopefully lead to those outcomes of employment and further education that we're looking for. They did think that COVID did not impact them quite as much as their supervisors were impacted by COVID. On the other side, it says both. So those were respondents who indicated they both ran a program, they were supervisors, but they also provided support and worked with youth and young adults with disabilities themselves. And they scored almost a full point higher than those supervisors alone on partner knowledge. So they have the big picture view of being a supervisor, but then take it into their work and apply it with their clients directly. They also had a higher view when it came to use of data for collaboration, and slightly higher about talking about the practices of collaboration. Okay, next slide. The last area of agencies' differences was on that level of collaboration, that data that was used to create that network map we looked at. And in this case, what we found out was that our educators in the kindergarten through 12th grade and career and technical education, that's what that CTE stands for. Those educators rated collaboration about a full point lower than their vocational rehabilitation colleagues. Those working in developmental disability agencies rated collaboration about a half point lower than their colleagues in vocational rehabilitation agencies. You'll note other, little hard to parse that out, that was anybody else who responded to the survey, but their agency did not fit neatly into one of these 12 categories. In some cases, that was Centers for Independent Living. We had some legal advocates and a couple of legislators respond to the survey. Next slide. And with that, we're going to pause on the study results. Matt will be coming back after to talk about our focus group findings. But now we want to invite Crystal Emery, who is with the Utah State Board of Education, and Amy Langoni with the Utah State Office of Rehabilitation to share about their work in action around collaboration in Utah.
Excellent. Thank you so much. I am Crystal Emery. I am one of the post-secondary transition specialists at the Utah State Board of Education. I am a middle-aged white woman with glasses and shortish blonde hair. Amy, do you want to introduce yourself?
Sure. Hello, everyone. I'm Amy Langoni, and I am the Transition and Supported Employment Coordinator with the Utah State Office of Rehabilitation, which houses Utah's Vocational Rehabilitation Agency. And I am also a middle-aged woman with dark, long hair and wearing a blue top.
Wonderful. Thank you, Amy. So we're going to share a little bit about what has been going on in the state of Utah around interagency collaboration. And we're excited to share out on our efforts and all that has been growing from them. So next slide. So in Utah, we have a collaborative called the Utah Statewide Collaborative on Improving Post-Secondary Transition Outcomes for Individuals with Disabilities, which is the longest title of anything in the entire world. We lovingly call it our STC, our Statewide Transition Collaborative. And that collaborative is a working partnership of all of our state agencies and then many other organizations in the state that serve transition age youth. So we were certain to include organizations that were disability specific, but also organizations that just serve the general population of transition age youth who might also be serving individuals with disabilities. So we really wanted to make sure that when we did our state infrastructure analysis, we weren't just looking at disability services, but all services that might be supporting transition age youth with disabilities. Next slide. So this slide is just a sampling of some of the agencies that are in our collaborative. So it includes our Utah State Board of Education, our Department of Health and Human Services, for people with disabilities, our Developmental Disabilities Council. We have our Utah State University and all of their resources and their initiatives around individuals with disabilities. We have our Utah Statewide Independent Living Council, our Utah Parent Center, the Utah Department of Substance Use and Mental Health, our System of Higher Ed folks, and many others, but these are just some of the examples. We also have our Intermountain Healthcare, which is it is our largest local healthcare organization or insurance organization in the state. And they have several initiatives around supporting transition age youth into transitioning into adult healthcare. And so we were excited that they were interested and willing to come on board with us. So next slide. So how all of this started is we have our coordinating council for people with disabilities, and that is a mandated group in our state. I believe it's in a lot of states, but in our state, it's mandated legislatively that we have this coordinating council that includes the leadership of all of the big state agencies around people with disabilities. So it includes the director of special education at the Utah State Board of Education. It includes our Schools for the Deaf and Blind, our Utah Parent Center, and I'm going to forget a whole bunch of others, but our disability, developmental disability agency folks. And they meet quarterly and address needs of individuals with disabilities in the state. And as a group of leadership, they identified post-secondary transition outcomes for youth with disabilities as one of the key challenges in our state, that our outcomes for our youth are not great. And so really looking at how do we fix that as a system? So they formed the STC, and that group met monthly for a year just to explore the current infrastructure. What is everybody doing? What services do they offer? What age groups do they serve? And stakeholders took turns presenting the services and supports that they offer to the group so that everybody just got to know each other and their services better. That alone improved our collaboration in the state, improved services in the state. Just from those stakeholder presentations, we were starting to see side conversations like, hey, I need to meet with you after. I have students that would really benefit from your services. Or, hey, can you come and talk to our staff? I really want them to know what you're doing. So just that alone improved our collaboration and our awareness of services and how we work together to serve youth in our state. But then our first goal of the STC, besides understanding each other as a system better, was to identify where we have gaps and overlaps in services, and then to start understanding how we might scale up our services or add services to better meet the needs of transition age youth with disabilities. The Utah State Board of Education took the lead on in this group, and we focused our state systemic improvement plan on post-school outcomes for youth with disabilities. And so as part of that, the STC created a theory of action and a logic model that drive the work. And I'm going to walk you through a little bit of that briefly. So next slide. Our overall goal of the STC is to improve the post-school outcomes in employment, post-secondary education, and independent living for students with disabilities in Utah through better interagency collaboration. So our goal is to improve post-school outcomes, and the avenue for doing that is this more intense and deliberate interagency collaboration. Next slide. So we started with lots of activities that brought us to our goals. So we started exploring the landscape and the infrastructure of what post-secondary transition services looked like in Utah. We identified our gaps and our overlaps like we talked about. And then as we created our logic model and our theory of action, that became our course that we were charting to improve our post-school outcomes. We had a goal. And then by bringing everybody together regularly and keeping them a part of this collaborative, we were able to keep regular stakeholder input for the plan. So we were able to assess how it was working, continue to make changes, and grow as a full system in the state. Next slide. So they hired me to come on after they had started the STC and they were doing these regular meetings to understand each other. They decided they needed a position to really facilitate this work. And so I got the opportunity to come on board, and I met with every stakeholder, a half-hour meeting, just a conversation about why are you participating in the STC? What do you think the benefits of this are going to be? What do you hope the outcome is going to be? And I basically did a really informal qualitative study on what's happening, and we pulled together all of their answers, and these 4 themes arose. Active collaboration. Everybody felt like we needed to be more actively and deliberately collaborating. It needed to be data driven. We need to be looking at our data together as a system and not just ideas about what we think is going to work, but what do we know is going to work. We need to have a shared vision as a state and as as multiple agencies, and we need to keep the people that we're serving at the core of all that we're doing. So that student and family focus. So next slide. And then from those themes grew our theory of action. So our theory of action states that if we implement the 3 broad improvement strategies of comprehensive supports for youth and families, a smooth flow of services, and better coordination of services, then we will see a reduction of the percentage of students ages 19 to 22 when they exit a post-high program who report being unengaged or underengaged 1 year after they exit school. So that's our indicator 14 requirement under IDEA. So we found that when we looked at our data, that 19 to 22-year-old population, those are the students that are staying after their senior year. Those tend to be the students with more significant cognitive needs or who would need additional time to work toward a diploma. And that population of students was had very significantly poor outcomes. than our general population of students. So overall, our students who are engaged in some sort of post-secondary education and training or employment in the state 1 year after they leave school was about 86%. But this population, it was about 54%. And so it was a big gap for this population. So this is the population we chose to target. So go ahead and move on. And so from our theory of action, so from the themes that were generated from all of those agency interviews came the theory of action. From the theory of action came our logic model. This is a very stripped down version of the logic model because it's impossible to put it all on one slide. But we started to identify then what are the resources and efforts that we needed to be expending as a system together to then implement these broad improvement strategies that we identified in our theory of action. And then we identified specific activities that we felt would address those outcomes. And then from those activities, measurable targets. So the meat of the work that we were doing. And we felt like if we were able to address all of these components, then we would meet our goal of improving engagement for our youth 19 to 22 who exit school. If anybody wants to see the actual logic model, I believe the slides are going to be given to everybody, and that was linked in the previous slide around the history of the STC. And you can get to that from there. So go ahead and move on. So I'm going to turn the time over to Amy for a minute just to talk about some of the outputs, some of the outcomes of this work that we've been doing.
Thank you, Crystal. I'm going to share a few highlights from a partner perspective about some of the outputs from the group. Of course, I'm not going to have time to cover all of them, but I feel like as a partner, we've had really successful engagement from members because Crystal really structures the meetings to have purpose and have outputs and be focused on outputs and finished products. We do dedicate time to sharing information and resources to help members with understanding programs that might fit their population, and try to generate referrals across partner agencies. We did create some organization presentation slide decks from each of our organizations to learn more about our partners. And then also we can use them if we need basic information to our community or in presentations that we're doing where we might need to reference our partners. We've also used our meeting time to revise existing resources and create new resources, which has been amazing for me anyway. One of the examples is my agency has a very large 8-page pre-employment transition services brochure that we use for stakeholders. But some of the members that represent parent groups gave feedback that we could benefit from having, in addition to that 8-pager, have a quick hitter. And so they helped us create a quick hitter 1-pager based on feedback considering parents. So that was really great. We also have a work group that's focused on working on a joint MOU and a referral form between our larger partners. The MOU is still in process, but they're able to use that time to troubleshoot and continue to work on it. And then lastly, as we're planning our annual Summer Institute on Post-Secondary Transition, we're consulting with our Services for Youth and Families Subcommittee to create a youth and family track, which has been really exciting. Crystal, is there anything you wanted to add?
No, I think that's a nice summary of what we've been doing. There are lots of other things that we have been able to accomplish, but I think that it's a nice kind of summary of what we've been doing.
Some highlights.
Yes.
And I think it's time for us to turn the time back over to Matt.
Before we go to Matt, though, I just want to say really quickly, our collaborative meets on a monthly schedule. So it's broken up into 3 work groups around those 3 broad improvement strategies. Those work groups meet monthly, and then the full STC meets quarterly. And then I report out quarterly to the leadership of the Coordinating Council for People with Disabilities. So if you're interested in the structure and how it all works, that's how we are doing it. And the engagement is really astounding that our partners come and participate and do this work and really work toward these outcomes. So we're excited about it.
Okay, thank you both. And so one thing I think is really exciting about hearing that example from Utah is how many of the things that came through in our research are actually kind of just naturally embedded within those things, everything from cross-training to designing MOUs to increasing frequency of communication, points of contact, so many things there that are just really great, excellent synergy. So I'm back to describe the second part of that study that Leslie gave you, the quantitative survey-based overview. But after we did that survey, which was nationwide, we tried to get all 50 states. We then did a deeper dive with qualitative interviews and focus groups. The objective was 10 states. We ended up getting 9. But these are the states where we did the focus groups. The idea there was we selected states where there were, by a number of different metrics, both from RSA 911 and from our own survey, where the levels of collaboration were higher by some measures than they were in other states. So the idea there being like, no context is perfect, but we were able to like pick out a few states where we could try to get a better, more granular understanding of what does and doesn't happen that supports collaborations, what some of the barriers are and things like that. So I'm going to, and just real quick, these are the number of the N value here is the number of participants from each state. The value on the right-hand column is the number of focus groups we held in that state. So Virginia having the most focus groups and participants, but that just wanted to give you an idea of where these came from. So these were the primary themes that came out of the qualitative coding process for those interviews. And again, these are things that I think our partners from Utah, like they really were mapped very well to what we were finding in our focus groups as well. So that topic of youth empowerment, which I'm going to go into in a second, is very much at the heart of what was just being described. So I think that's great. The topic of formality of relationships between agencies was a very common topic. We're going to give you a little bit of an idea what that meant. Obviously, barriers and carriers to information and resource sharing, levels of communication was a big topic, and then the impact of COVID-19, both in terms of some of the barriers it created, but also some of the learnings that came out of that. So first off, I want to start with this idea of youth voice, because this was prevalent throughout all of the states where we did the focus groups. It was something that was kind of tangentially or directly involved with almost every other sub-theme that we discussed and learned about in the focus groups. And the idea here was that too often when we think of collaboration, in the workforce context, in VR, but also just in life and elsewhere, we forget to situate sometimes the person who's actually the end receiver of the services, the opportunities that come from that collaboration. So this idea of youth voice was remembering to situate youth at the center of your collaborative networks, your collaborative efforts, and empowering those youth as they transition to adulthood, and in particular, making the transitions between systems and the coordination between systems something that empowers them, not something that is a source of gaps or frustrations, right? Which, again, only so much is possible, right? When you're talking about different systems that have different objectives and as well as resource and funding limitations, things like that. But it's just kind of a way to reframe what you're doing. This is the only quote I'm going to read, so I don't want you to think this is going to turn into me reading off my slides, but I do think this was an important one to get across because this was actually one of the quotes from the focus groups, and I think it kind of summarizes this theme. The quote is, "I think I'd like to see more youth voice being used in service delivery. We've really tried to increase our hiring of young people with lived experience in our system, give satisfaction surveys and being part of program development itself. And I think it really helps make sure that your service delivery is improving in a way that meets your clients' needs." So within each of these themes that we uncovered through our qualitative coding, there were also subtopics, right? So in the youth empowerment topic, there were things like client self-determination, in their decision-making processes around service receipt, supports, job pursuit, whatever it might be. And another thing that I think is really important is, and this connects back to my own work with the justice system and the child welfare system as well, is often other systems that youth have been in they can feel somewhat disempowered. So also thinking about how you can shift that narrative with a young person that's being worked with. Another big one was communicating the complexity of these systems. So one thing that we found from both the quantitative and the qualitative part of the study is a huge barrier to collaboration is actually just interagency understanding of what other agencies, potential partners offer what they're doing. And again, that's something that I think Crystal and Amy kind of talked about with the design of their work, which is that, even offering cross-training opportunities for information and resource sharing, and just better understanding of where you might refer someone can be really powerful, and can help reduce service gaps and things like that. And that was the other main issue. And so I'll give one example, right? But rates of referral are very low, for instance, nationwide between the justice system and vocational rehabilitation. So also putting on your quantitative hat a little bit and trying to identify, like, where aren't the referrals coming from? Where do we need to make those connections so that youth don't feel that loss of contact, don't drop out between systems, things like that. Another topic was formality, and this one is weird because I think Leslie and I have been studying collaboration together since like 2018 or something. We initially started this work on one of the Promise demonstration projects in New York State, and this topic of formality, it always comes up. It's kind of been like a persistent theme throughout our work, and it's interesting because there's two parts to it, right? There's on the one hand, a lot of the focus group participants were insistent that we not forget about informal connections at the local level specifically. And they were talking about how they build, like, that's oftentimes how you build really strong collaborations, is through informal getting to know people, creating points of contact. And a lot of what was being asked, especially by frontline service providers, was for formal structures to be put in place to make that a little bit easier, so you don't lose your point of contact so that collaboration doesn't crumble when you lose a point of contact, so that you do know who to contact with a particular problem at a particular agency. And so that's what brought about this idea, this kind of focus within the interviews on interagency agreements, memoranda of understanding, memoranda of agreement, and in particular, the need for those to exist at both state levels between key agencies and departments and offices, but also at local levels, right? Help in how to build these out. These essentially, they're a type of usually a non-binding agreement, but they help structure a scope of work and a collaborative objective. The one thing that kind of did come through in the interviews was the idea that formal collaboratives, they can't only exist at the state level in the form of interagency working groups. Not that those aren't important, but there was this idea that it has to trickle down to actual frontline service delivery, and overcoming what was perceived by some frontline staff as kind of a policy and practice disconnect, where there is this collaboration at the higher levels of the state, but it doesn't always directly impact your real work on the ground, right? And then another major topic that came about was the idea of thinking. So this is where those network maps can be really important, right? Is visualizing in a real way, like, what does your network look like? Who is on the periphery of your local network? Who do you need to engage that you're not engaging? It could be, law enforcement. It could be a hospital. It could be a hospital at the local level. It could be your Title I workforce partners, whatever it might be, or community rehabilitation providers in a specific sense. But one thing that different participants in these focus groups kept talking about was the need to also identify if there is a gap, who can be a bridge, who can help facilitate that connection. It could be somebody at the county. It could be somebody who works with both agencies, right? For instance, one example we saw was mental health offices were often very valuable bridge agencies between workforce or VR and corrections, right? Because they tend to work with both agencies frequently. So that's one of the goals of turning collaboration into a little bit more of a science, right? It's tough to turn something like that into a pure science, right? But you're thinking about it a little bit more empirically and a little bit more critically. You can use that to identify these gaps and build those more formal connections. Another thing, and again, this actually connects really, really strongly with the topic of increasing formality, is information and resource sharing, right? So one thing that I think came out from these interviews is the idea that an MOU or an MOA, for instance, doesn't need to be, it can be, but it doesn't need to be this massively far-reaching agreement. In some cases, it's just outlining specific targeted goals that can be things like increasing information sharing, developing points of contact, doing cross training, which as we've seen in the research, supports the idea that that's really it's impactful out of proportion with what you'd think, right? That cross training is an opportunity for information sharing, for building points of contact. And that's kind of what we mean by these instrumental objectives, right? You're trying to find things that you can do within budget that are practically achievable, that can help move the needle more towards these kind of instrumental improved collaborations. Another thing that came up though within that is data sharing being a particular challenge, right? Because that's not as easy as other things, right? Different agencies have their own risk tolerance around what they're allowed to share, release of information challenges, and things like that. So that was kind of common across context, was like really being thoughtful and innovative in how you can share key data. And that actually in a weird way connected back to the youth empowerment thing too, which like one topic that did come up a lot was just how frustrating it can even be for youth and families to have to answer similar questions over and over and over again as they're going from system to system. And that was, again, some of this is within frontline practitioners' capacity, other things that's kind of outside of their control, right? So legal and process barriers were a big part of that data and resource sharing. Communication, right? Again, this is something where it sounds like I don't want to use the wrong word here, but it sounds like it can be kind of a flimsy concept of sorts, right? You might think you're communicating well with somebody, but you don't know for sure. But the one thing that was kind of highlighted was that formal agreements and partnerships between agencies can help clarify what it means to be effectively communicating across agencies, right? It can mean, who's in a room, who's at the table, right? What's the frequency of communication that's required, right? How long is reasonable to hear back from somebody, right? These are things that actually do make their way into certain agreements. And role clarity was a big thing that came out there, right? It's like, it's one thing to have an agreement where you're saying you're going to communicate, but if you don't know who is supposed to respond, who's the primary point of contact for in a given role, what they're supposed to do once they receive a contact, that weakens the strength. I mean, that undermines the impact of these formal agreements. And then again, all of this to say, and this is something that was discussed at the beginning, right, is this isn't to ignore staffing capacity and resource issues, right? A lot of what we heard is that different agencies have to be creative about, braiding positions, working together to find kind of strategies that don't, break your budget, or that acknowledge the fact that there are resource and staffing and capacity issues across many agencies. And then lastly was this effect of COVID-19 on service delivery. And again, this is becoming, it's kind of incumbent on us to actually talk about this because it was something we set out to study. But one thing that COVID-19 across context really did bring out is not only the fact that service disruptions happened because of the pandemic, but also the ways that kind of exacerbated existing technological and geographic barriers for youth that are already in some cases underserved, right? So it actually in many states kind of highlighted problems that were there already, but they were really made worse by the pandemic. And at the same time, because of that, you saw different states doing all kinds of things that just weren't on the table before, right? They had people driving, they had assigned roles where people were driving all over the state. In some examples, they made much greater use of telehealth and even remote meetings. That was an odd outcome of the pandemic in some states, was that like, okay, we want to do cross-training, we want to do interagency collaboratives. Suddenly Zoom meetings are much more normal, right? Or whatever platform you want to use, right? And that was actually something that it's weird, but these little kind of changes can bring about more opportunity so one thing that we did learn from that research was that it wasn't all bad that came out of it, right? Some of these things, it was a shock to the system in a real way, but there were also some innovations that came out of that a lot of the people we spoke with, they want to carry forward past that point. So this is my last slide, and then we're going to actually hand over for closing remarks. The kind of final policy and practice recommendations that we took away with it is whether you're local or state whether you're a supervisor or frontline staff, thinking about who your weakest partners are, and how you can build collaboration specifically with them. So the examples that Leslie pointed out were, juvenile justice, child welfare, Title II programs, higher education. That's a snapshot nationwide, so it's not going to be true everywhere. But kind of having your finger on the pulse of who are your common partners, who are the places that you struggle to build those relationships with, how can you bridge those relationships, who are the right points of contact and liaisons to do that. Cross training was a huge thing, and it kind of got back to that idea that one of the biggest barriers to collaboration is a lack of interagency partner knowledge, and cross training is in a very real way a practical opportunity to share information and resources and better understand how coordination between systems looks, right? Because often different agencies and different community level partners, they're going to have their own barriers to working with another agency, right? So it's sometimes hard to kind of see the other side unless you're in a room together. And then on a very different level, it's just an opportunity for people to make points of contact, right? So in a just very practical way, cross-training can actually, in the research, can bear out, much kind of outsized benefits, right? As though what's beyond what you'd expect. And then again, this connected to the learnings from the experience with the COVID-19 pandemic is really addressing this issue, especially because this is so important within WIOA's framework of youth with digital divides. That could be youth who have been involved in the justice system, youth who are below the poverty level, youth who live in rural areas. These are underserved populations within WIOA's framework, and those digital divides and technology barriers are further kind of exacerbating some of those divides, right? So thinking about how you can strategize with other agencies to build that kind of to bridge that challenge. Okay, with that, I think I'm going to hand it back to Kim to introduce our final remarks. But thank you for your time, and I hope I was kind of clear with what I was talking about.
Matt and Leslie and Crystal and Amy, thank you so much. So much great information, and I can see everybody's passion and commitment. And we know that collaboration is not easy. And Matt shared several of the things that get in the way of us being able to do it effectively. And long term. So I appreciate all of that. I do want to ask Leslie, if you can come back on for a minute. There was one question in the Q&A that was relating back to the social network analysis map and talking about the overall averages for the nation. And it was specifically, asking a question about could we say that in some states collaborative practices might be higher? So I wondered if you could address that before we go to closing remarks, and then immediately after closing remarks, we'll facilitate the Q&A with the other questions that are already in the Q&A, as well as additional ones that might be generated.
Sure, happy to do that, Kim. So I'll talk a little bit more about the scale. I mentioned before it was a 0 to 5. And it had 0, basically, I have no contact with this agency. 1 is networking, that's some awareness of each organization. Little communication, independent decision-making, all the way up to 5, which is 1 system, frequent and trusting communication, and consensus decision-making. The national average was actually 1.9, which is close to cooperation on the scale. Cooperation stands for providing information to each other, roles somewhat defined, formal communication, and independent decision-making. I will say, and this is just based on state averages, so everybody's response for an individual state, those values were averaged up, and the lowest state rating was at a 1, which is at the networking level. The highest was 3.6. And so, which is running up between what on the scale coordination and coalition. Coalition is sharing ideas, resources, frequent prioritized communication. So prioritized communication, I think about it as email. I'm going to pay attention to that email and get back to this person by the end of the day. And so there was a wide range of responses from state to state, and what their average collaboration rating came out to be. Hopefully that answered your question, Jessica.
Thank you so much. And yeah, absolutely, there are differences across the nation, especially when it comes to the wide range of agencies that are at the table here or need to be at the table to support youth and young adults with disabilities. All right. So we're going to hold on the other questions for a few minutes as we go to our last speaker today. We're really excited to have Assistant Secretary Taryn Williams. She is the Assistant Secretary of Labor for Disability Employment Policy. She advises the Secretary of Labor on policies and different programs that affect employment for people with disabilities. She leads ODEP's team working with employers and all levels of government to promote evidence-based policy that is improving those employment outcomes that we talk a lot about. She previously actually served as a managing director with the Center for American Progress, chief of staff previously at ODEP, and was an associate director for public engagement at the White House, working on a variety of issues that were related to education, workforce policy, Social Security, Medicaid, and civil rights. Taryn worked as research coordinator at the Institute for Educational Leadership and as the director of programs at the National Association of Urban Debate Leagues, which was headquartered in Chicago. She earned her master's degree in education from Harvard University and a bachelor's degree in public policy from Brown University. Assistant Secretary Williams, we are so excited to have you. Thank you so much for joining us today.
Thank you so much, Kim, for that lovely introduction. And I hope everyone kept in the event. So I found a quiet corner to greet all of you. I first want to thank you for being here, your presence that you all have to help all Americans, including youth and young adults with disabilities, obtain and maintain high quality jobs in in-demand occupations. It really provides an overview of ODEP's focus on collaborations under the WIOA and the work that we do to further support employment opportunities. As you all know, WIOA aims to promote stronger alignment of workforce, education, vocational rehabilitation, and other human services systems to improve the coordination and delivery of services to individuals. Much of that collaboration occurs at the state and local level, but I really want to speak to the power of collaboration at the federal level. As you may be aware, ODEP is the only non-regulatory federal agency that promotes and coordinates with employers in all levels of government to increase workplace success for people with disabilities. We could not exist without intentional collaboration with our federal partners. We know that youth and young adults with disabilities face systemic barriers in fragmented systems, and this structure makes finding and thriving in employment challenging, and particularly for those from historically underserved communities, the barriers are multiplied and complex. It's our mission to develop and influence policies and practices that increase both the number and quality of employment opportunities for people with disabilities. We do this in a range of ways, including funding several national technical assistance centers and demonstration projects, Cape Youth being one of them. And our goal is to move the needle in people with disabilities having unlimited employment opportunities. Given our mission as an agency, ODEP works to intentionally align our policy goals with our federal partners, such as the U.S. Departments of Education, Health and Human Services, and the Social Security Administration. We've all worked together to provide funding opportunities to states to create demonstration projects that encourage collaboration, and enhancement of the delivery of programs and services to youth and young adults and their families. Not only do we at ODEP collaborate with our federal partners, we also collaborate within our own agency at the department, including with the Employment and Training Administration, or ETA. I know you heard from my colleague Jennifer Kemp from the Division of Youth Services during the opening today. And I want to give you an example of the type of work that we do. The department recently awarded 4 cooperative agreements totaling more than $67.1 million in funding over a 5-year budget period to support the development of innovative strategies that will help youth and young adults from diverse underserved groups successfully transition into the workforce. The 4 state awardees are Connecticut, Kansas, Minnesota, and New York. And the Equitable Transition Model, or ETM grants, as we call them, are administered by ODEP in collaboration with ETA. In closing, I want to note that we must ensure that youth and young adults and their families have access to the full array of services at the local level. And we at the federal level must do our part. Also, we must ensure that eligible in-school and out-of-school youth and young adults have every opportunity to access services from the workforce system. Similar to the federal level, we understand, as you do, that local and state agencies cannot work in silos. And as required by WIOA, we must collaborate. And that's one of the reasons why today's webinar focuses on exploring opportunities across youth and adult workforce systems. You got to hear more about our ODEP TA Center, Cape Youth, the results of our National Systems Collaboration Study conducted by Cape Youth, interagency collaboration within the context of WIOA, and local and state policy considerations. It's my hope and that of my colleagues that you leave today with some good ideas and policy considerations to take back to your communities as we all work towards that collective goal of ensuring that youth and young adults with disabilities can obtain and sustain good jobs. I want to again thank you for your commitment to this work. Thank you for having me here today. And I'll go ahead and turn it back over to Kim Osmani with Cape Youth to facilitate the Q&A section of the webinar. Thank you so much.
Assistant Secretary Williams, thank you so much. We're glad you were able to make it with us today and for sharing some of the initiatives and the tremendous funding that you all are able to put forth toward efforts like the Equitable Transition Model to help those marginalized and underserved populations. Thank you so much. We appreciate you being here. So that concludes the presentation portion. We're going to facilitate a Q&A portion right now. But before we take questions, I just want to share a few items on this slide, which I believe our colleagues are going to put a hyperlink also in the chat for each of you. On the left, you'll see 2 QR codes on this slide, as well as on the far left, you'll see the Cape Youth email address, which is hyperlinked when you get the slides. Our email address is info@capeyouth.org. The left-hand side QR code is actually the survey feedback for today's webinar. So we definitely want to hear your thoughts on today's event, but also what else do you need? What is additional information you'd like to see in future webinars, future research, future policy briefs, future blogs, future 2-pagers? What are some of the key things? But definitely you can scan the QR code or you can click the link that I believe was just put into the chat. On the right-hand side is another QR code, and that leads you to our technical assistance page on the Cape Youth website. We are, as Assistant Secretary mentioned, we are one of the nationally funded technical assistance centers at the U.S. Department of Labor. We are here to provide free technical assistance, which can be universal, like this webinar today, or targeted, kind of a one-time event, or some maybe information or question that you have that we can help you research and find information. We also have a intensive technical assistance where it's more elaborate work with you over a period of time. So you can scan that QR code to take you to our technical assistance page, or feel free to visit our website at any time and go to our technical assistance page where you can submit your request that way. You can also do it through email. So please always feel free to reach out to any of us, go directly to the Cape Youth website or email us at that info@capeyouth.org. All of those items, I believe, are linked in chat. And what we're going to do is keep this slide up during our Q&A session that we'll facilitate now with all of our presenters. So if you have any questions for Jennifer Kemp with ETA, or our partners that are here from Utah, or Matt and Leslie, or Assistant Secretary, this is your opportunity now to please put those in the Q&A, and our team will start responding to them. So I'm going to look these over. I think the first question is actually for Crystal and Amy, and it was going back to your logic model, and it was a question about your measurable outputs. You mentioned that there were some resources that the team was creating or was thinking of or planning or in the middle of creating. And I think a question is like, what are some of those resources that you did create to reach your measurable outputs?
So one of the items that Amy mentioned was our kind of a quick hitter for our pre-ETS information for families. We also put together there were specific resources that we wanted to highlight that were already existing in the state that we wanted to improve utilization of. So instead of creating new resources or new programs, we wanted to improve the utilization of the things that we already had. So we also created a flyer that shared information around our Utah Parent Centers, training opportunities, and pre-employment transition services, and our developmental disabilities agencies opportunities as well. And then, oh my gosh, I feel like there's so many things, Amy, but those were a couple of things. And then as far as outputs around agency collaboration, we created a universal referral form that all of the agencies had input on. And so it's just a basic form with contact information for referring to a new agency, but it also has a very simple release of information, so that if parents say, yes, I want to be referred to this agency, and you can share my contact information with them so that they can reach out and schedule an intake. So we're trying to take the onus off the parents to have to always be the ones to reach out if they have an interest or a need. And so we are piloting that right now with some educators in the state to see, and we're just taking data right now on how many parents think it's a good idea and how many parents are saying, no, I don't want to do that. So that, like, we're not really doing a lot of data collection on that just yet. And then some of the outputs had to do with our annual Institute on Post-Secondary Transition. So the STC offered support on creating the schedule for that institute, and they supported a family track. And then this year coming up, they're going to support a family track and a youth track for our Institute on Post-Secondary Transition in the summer. Amy, what else? Like, there's just so much.
The slide deck, I think we talked about earlier, just creating some basic information
right.
so that we can use when trying to help spread the word about our partner agencies. So, like, for example, if I'm doing a presentation on supported employment and I want to talk about our developmental disability agency, just giving some basic information so that we're speaking to what the agency wants us to speak versus having to recreate the wheel.
Yeah, I think really our big focus. Yeah, our big focus was trying to better utilize what we already had in place. And so we focused on the Transition Institute that was already running some of these resources like pre-ETS and our Transition University through our Parent Center, things that we felt like would make an impact if families knew about them and used them. So that was kind of our big focus to start. And then our data collection around that was, how many pre-ETS students do we have? How many students do we have participating in Transition University? How many teams do we have coming to our Transition Institute? So the outputs that we targeted were specific to the opportunities that we were trying to enhance in the state. There's a lot more, but that's kind of the big overview.
Thank you both so much. That was very elaborate. And I'm sure if folks have more questions or want to have other examples shared with them, they can reach out to both of you. Wonderful. Thank you so much. So we're going to go to one more question. I'm looking at time. We've got about 4 minutes left, so we won't be able to get through all of these, but we can follow up in, via email or in some other written fashion to answer some of the other questions. But I do want to address a question that I believe was posed regarding youth voice and how it should be compensated, and wondering what are the funding sources that can support that. And I think Jennifer Kemp has volunteered to answer that question.
Yes, I'm happy to answer that question because this falls into the bucket of things that I feel proud about. At ETA, we have been able to compensate for youth voice by calling them what they are. They're subject matter experts. And so when we put contracts together for outside speakers, outside events, or when we get grant proposals and people talk about the role that subject matter experts are going to play in their grant design, youth can count as subject matter experts because they are. You know, we were young once, but we're not youth subject matter experts anymore. And so we do compensate youth subject matter experts at the same rate that we compensate other subject matter experts, which is, you know, which is a healthy hourly rate. I mean, you know, different states have different procurement rules about what you compensate folks for, but we are able to provide them with either a daily or an hourly rate. And, you know, if they're traveling for an event, we are able to cover the cost of their travel. And in cases when they were under 18, if the parents or a guardian wanted to travel with them, we have also provided the funds for that person to travel with the individual, but not to attend the meeting, because we're paying for the youth and not the parent experience. And so, you know, obviously that might be different if a person has a significant disability and needs some sort of personal care attended with them, then that may look different. But typically, when we are talking about youth voice and involving young adults, we're talking about people with non-apparent disabilities that tend to be in the mental health or learning disability space, and they, generally speaking, do not want their parent with them. And so we honor that perspective because they're the subject matter experts. So that's one thing we feel really good about. And there's another question, actually. There's 2 minutes left. I'm just going to say there's a question about what's needed to make employment work. And one thing I also want to highlight that I feel good about is the role supportive services play in terms of making work. And so supportive services is like funding to get the equipment you need to do the job, or maybe it's transportation, or maybe it's anything you need to do your job. And again, that's a place where I would encourage you to work at the local level with your Workforce Innovation Opportunity Act workforce boards or the programs, because our funds can pay for supportive services. So if you're working collaboratively, ideally you will braid the funds and be able to use our funds to support your projects as well. So I just wanted to get that push in there. Both of these things are talked about in guidance. So it's not just my word, there's stuff in writing to help with that. So thank you. I'm turning it back to you, Kim.
Jennifer, thank you so much. We really appreciate that. Well, thank you. I know we didn't have enough time to go through all of the questions. Unfortunately, we are out of time, but if you have additional questions, you can feel free to reach out to us. I just want to thank all of the speakers that were on today from our various partners and everybody that's here, including all of you, and the support and passion that we all have just to help youth and young adults with disabilities. We are going to be able to email all of the registrants, or all the registrants actually, the recording of today's webinar as well as the slide deck, including all of the linked resources that were shared from the webinar. They'll also be available on our website within the next week or two. And again, just want to thank everybody for being here and all the expertise and insight that was shared today. And we hope everybody enjoys the rest of their afternoon, and we look forward to seeing you on a future Cape Youth webinar. Thank you all.